This is giving women the power to make a choice. What do you make of Apple and Facebook doing this right now?
Yeah, we applaud their efforts. They're definitely tech innovators, and so as innovators, they're leading the space in the employee benefits areas as well.
How likely will other companies follow suit?
We anticipate that in addition to other tech companies following suit, that a number of other large corporate citizens will, in fact, pay for egg freezing for their female employees.
Gina, is this telling young women or women who want to be moms, we want you to be a mom, just not while you're working here, we'll help you put it on ice? Or is this really sort of pro-family?
Yeah, I think it's absolutely pro-family. I think what they're trying to do is help women to the degree that they can have it all, be able to do that. And so I think both Facebook and Apple and all large corporate employers that embrace this would tell couples to try and conceive the old-fashioned way. Certainly, we endorse that as well. But in the event that that doesn't happen and you want children later in life, this is almost like an insurance policy so that you will be able to conceive in your mid to late 30s or whenever you so choose with eggs that you may have frozen in your late 20s and early 30s.
But is the company sort of engaging in false promises? I mean, fertility from this kind of thing is very difficult. In vitro is so very difficult and often not covered. Is this really sort of making false promises and really putting the interests of the company first, saying work now, have babies, later? We're not, it just seems to me that it's not really helping people have children. It's sort of making it harder and making it put it off.
It's also a pretty invasive procedure. It's not like you just snap your fingers and your eggs are harvested. It takes a while and it's very costly.
Yeah, so I'm going to answer those two questions. The first one is about false promises. So fertility is directly related to age. And we've seen success rates as high as 50%, 65% with as few as 6 eggs. So, and it's not a linear thing where if you know that in 50 to 65% of the time you're going to get pregnant with a lot of, and a lot means a package of 6 eggs. It wouldn't mean that if you froze 12 that you had 100% guarantee of success. It just means that your success is much likelier. So it is not a false hope if you freeze eggs when you're younger. It is much more difficult to conceive with frozen eggs after the age of 35 as your fertility declines. The second question, Emily, about the cost for treatment and whether the procedure is invasive, it's actually not invasive. An egg freezing cycle is half of an IVF cycle. I underwent several IVF cycles myself. You get accustomed to the injections. It's easy to inject yourself with the medication. The retrieval is a 10 to 15 minute outpatient procedure. Most of our patients return to work the same day and for sure the very next day. So we actually don't think it's medically invasive. It's an outpatient procedure. As far as the cost is about $10,000 to $13,000, and that's where companies like ours, EGGBANXX, helps the patient finance treatment. We negotiate with fertility practices around the country, exclusive rates, and then we share those exclusive rates with our patients and allow them to finance treatment, making egg freezing a very affordable solution.
How widespread is egg freezing today? I mean, I know it's been around for 30 years, the technology at least, but how many people are doing this, and should it be routine?
Yeah, we think that egg freezing will become standard of care in the next 5 to 10 years for all professional women. As far as growth rates, we're seeing about a 45% annual CAGR over the last 5 years. Today's egg freezing in 2014, we've projected with the research that we've done about 15,000 cases of egg freezing today. We anticipate that 45% CAGR could get as high as 50% over an annualized basis, so that over the next 5 years you could foresee 60,000 plus annual cycles, egg freezing cycles.
Now, Gina, just one more question. This also opens up a conversation about the cost. Perhaps if you freeze your eggs, you may not be able to carry those eggs yourself. Should employers also be covering the cost of surrogacy and storage beyond that?
Yeah, I think it all goes back to retention and recruitment of employees. And I know Apple and Facebook in particular have surrogacy plans. So it's really up to the individual employer. We've seen these two innovative companies be leaders in their field. And so, you know, they're providing very aggressive benefits. We anticipate other companies to do similar things. Maybe not to the extent that Facebook and Apple have done this. It's an incredibly generous benefit for sure.